Okay. Right, just a quick poll before we start. Just hands up. Who here wants to do dentistry? Who really knows that they want to do dentistry? Okay. Who's not quite sure? Who's thinking maybe, maybe not? Okay. And who's here because their friends are here? Okay. Good. Well, at least you're honest. Okay, so what I want to do today is just give you an idea of dentistry, what we do. And when I was sitting where you were sitting, I had a few questions going through my head. And hopefully what I want to do is try and answer those questions. And then at the end we'll give you some time to be able to ask me any questions as well that you may have. Okay? Right. Okay, just a little bit about myself. I qualified in 2001. I set up a practice in Preston in 2008, and I work as a dentist together with a team to serve the local community. That's our practice website, so you're more than welcome to check that out. And there's a lot of information there, and it'll also give you quite a good idea of what we do, how we help people, and quite a good idea about dentistry as well. Okay, just to give you an idea of where I work. This is the practice.
Hi, my name is Nadim and welcome to Lifestyle Dental.
Okay, so that's the practice where I work in. Like I say, it's based in Preston. And we set that up about 2 years ago. Okay, so moving back to dentistry. So why dentistry? I mean, when I was sort of 18, 19, I was a little bit unsure about what I wanted to do. Although I knew a couple of things that I was good at. One of them was science. I was very good at science. Had a very scientific mind. I was good at art. I liked working with my hands. I liked art itself. And I also wanted to work with people. I wanted to help people, and I wanted to serve the sort of local community. So putting those together, I was sort of unsure about how I could find a job or a career that sort of worked all those three together. I spoke to a few friends, and one of them suggested dentistry. So I had a look at it, and I had to think about things, and I decided that's what I wanted to do. What I want to talk about today is what it takes to be a dentist, what career options are available after you qualify, and also the rewards and benefits of being a dentist as well. And also, like I said, we'll give you some opportunity for questions at the end as well. So, like I said, I was very good. What it takes to be a dentist: artistic, to have quite good manual dexterity. And what I mean by that is to have a very keen eye for sort of arts. I mean, creating people's smiles and being able to see the difference between smiles and things like that. So it helps if you do have an eye for that as well. Science as well. So if you want something that's going to be intellectually stimulating, dentistry itself is very, very stimulating. It's a science-based industry. There's a lot of scientific background into it as well. Yes, and also the biggest thing is helping people. You get to help people, you get to serve the local community, and that's the biggest thing that I find rewarding from dentistry, is it's serving the local sort of community really. Okay, dentistry, a little bit about the actual course itself. Dentistry is a 5-year course, and then 1 year training. And then if you decide to go into any kind of specialization, there's further training as well. The degree itself is quite, there's a number of universities throughout the country that do it. I think altogether there's about 8 or 9. And roughly they take on around about 50 to 100 people each university. So the entry is quite competitive. Actually getting in can be quite difficult. You need to have, as far as I know at the moment, you need to have quite good grades. You're talking sort of A's and B's in sort of A levels. You need to have work experience, and also there's an interview as well at the university that you go to. Different institutions have slightly different entry requirements, and you're probably best speaking to the administration tutor at each university to find out exactly what's required. They also now do something called psychometric tests as well, and that's where they test your attitude and your skills and things. So it's quite sort of competitive to get into. Once you get in, like I said, it's 5 years. There's exams sort of at the end of every year and also in between, and there's also clinical learning and teaching as well. So during the course itself, you get to actually treat patients. So very early on, I know that they like to sort of within the first or second year, you actually get to treat patients. That's good in one sense because it keeps you sort of motivated, gives you a very clear picture very early on as to what you want to do, and how sort of dentists work as well. So that's quite a good, nice thing as well. Again, different universities work slightly differently, so probably be a good idea to sort of find out from the university more about the individual course. And what you'll find is that at different universities they'll probably sort of teach slightly differently, and some you'll see patients earlier on and others a little bit later. And it's also a very demanding and stimulating course as well. Like I say, there's exams at the end of every single year, and there's also sort of in between as well. So it's tough, but it's very rewarding as well. And like I said, there's once you've qualified as well, there's also something called VT as well, which is vocational training. So you have to do a year's worth of training, and that's paid. You do get a salary for that. And once you've done that, then you can you're sort of fully qualified dentist. Okay. So what happens after you qualify? Well, there's a number of areas that you can work in. What I've done is actually split the sort of specialisation into the locations that you can work in. You can work in a hospital, you can work in general practice, or you can work in community as well. So I'll talk about these three. Essentially, in sort of general practice, that's where I work in at the moment, and that's your sort of high street dentist, or the dentist that you're sort of used to seeing on the high street. The type of work that you do there, you see patients on a day-to-day basis. You'll have a sort of list of patients. The sort of location itself means that you're quite a small team. You have about sort of 10, sort of at most sort of 10 to 15 people that you work with very closely. It has quite a nice feel to it, and it can be a very nice place to work at as well. Hospitals. If you preferred working in a big place, a lot more interaction, then hospital dentistry could be the sort of career for you. The main difference is, I guess, is the feel of the actual location. I mean, in general practice, like I say, it's a very close-knit team. You're working with sort of people who you see, who you get to know very well, and you also get to know the patients very well as well, because you see them on a regular basis, and they become sort of almost friends, really. Well, you do become friends. Whereas in hospital, sometimes you don't see the same patient again. and also sometimes you're working with different people all the time as well. The type of work that you do, I mean, in general practice, there's a number of specializations. These specializations can be in general practice as well as hospital as well. So you've got orthodontics, or sort of braces, people who treat children and adults for braces as well. And that can be done in general practice or hospital. Then you've got the other specialties, which include sort of oral surgery, restorative dentistry, and sort of implant dentistry as well. And like I said, those specializations can be done either in general practice or hospital as well. And then you've got community. Community dentistry is slightly different. What tends to happen here is you tend to, these are practices that are based in sort of community centres, and you're working with people with special needs and sort of children as well. So when I say special needs, these are people who are unable to be treated in sort of general practice or hospital. And that can be very rewarding in itself, because you're treating people with disabilities and also children as well. So those are the sort of areas that you can work in. The benefits, like I said, like I mentioned before, job satisfaction. One of the biggest things I find is the actual reward is sort of being able to see somebody, treating them from the start to the finish and seeing the change in them, and also the difference that you can make as well. And that can be very rewarding as well. And it's very stimulating as well. Dentistry is changing, just like anything else out there at the moment. If you were to do dentistry, like say over the next, you've got a 5-year course, and what you'll find is that when you enter to when you sort of graduate, you'll find that dentistry will probably be a very different world. The changes are good. It's very exciting out there at the moment. There's a lot of opportunity as well, and like I say, it's very rewarding. It's stimulating. And what I mean by that is it sort of pushes you to the limit, what it can do. You know, you're seeing people, constantly new technologies coming in, things are changing, and that in itself can be very sort of demanding as well, to keep up with the new technology and the new things that are on the market as well. And the biggest thing is interaction with people. Because like I say, you're dealing with the general public on a sort of day-to-day basis, and if you've got a very sort of keen desire to help people, then this is a very rewarding and stimulating profession. Okay, just a couple of pictures. This is just to give you some idea of sort of what I mean by job satisfaction. This is the patient that we treated. This really sums up for me what it means to be a dentist, to be able to help somebody like this, to be able to change a life. It's just very rewarding for me. I'll just play this so you can.
My name's Jenny, and I just want to thank Nadim and the girls at Lifestyle for actually giving me a smile back. For years now, I've always been conscious of my teeth. Unfortunately, there's no enamel left on my teeth, so any time I ate certain food or drank, my smile always ended up a very dark, reddish browny colour, and it was embarrassing. So for years, when I smiled and laughed, my hand would always sort of cover me. I was always conscious of that. I like going out a lot. We go to golf clubs and we go to do's and functions and things like that. And I work for a company where I meet customers, and again, my hand would always go up when I smiled. Now I've had the veneers, and my smile, my confidence, when I walk in somewhere now, I can actually feel myself smiling. I must admit, a couple of times I'm not the best of persons at dentists. I get very nervous. As a child, I never liked dentists. I had a bad experience years ago. So the fear was always there, and it's a little bit uncomfortable to have it done, but like most things, the effect to make my personality come alive again and to smile, and I feel younger. I'm nearly 60, and I feel 15 years younger. And at the end of the day, it was worth it. It was worth the effort. The girls, Nadim was fantastic, and I recommend anybody to come.
Okay, so I mean that for me just means everything really. To be able to change somebody's life in that way, you know, to be able to, for somebody who's just embarrassed about smiling, to go from there to actually be able to have the confidence to be able to smile, and that for me is what it's all about, and that's the job satisfaction that I get from it. Just to give you another. This again is what can be achieved. So this was a young girl who came to us. She was about 21. She was very shy. She had her hair sort of covering her face, and she was very embarrassed to smile because of the gaps between her teeth. And the transformation that we achieved was just amazing. So this again, just from the side, that's from the other side, and that was afterwards, and that's what she had to say about it. So like I said, she was very unhappy about her teeth. She didn't smile. We did some veneers for her, and now she loves a new smile, and she's happy, and she's able to have the confidence to be able to go out there and smile at people as well. And that, again, is the job satisfaction that I get, to be able to help people to smile. Okay, so a few minutes. Right, we'll take some questions. So, have you got questions? Anything you'd like to ask?